right, we are at our last session for the day. Before we get started, I just want to remind people that there are definitely links in the platform under surveys or programs for things you could take to give us your input. We also, starting at 3:30, are going to have a call specifically with the non-clear cell patients. If you want to offer things, there's a link on the program section of the platform. But this is going to be a great sort of culmination of everything we've talked about today, because regardless of all the facts and figures and the different information we've gone through, today, the last one is living with kidney cancer. What that sort of means, what do you wish you knew? What do you wish you could share with other people and experiences? Help make the journey a little bit easier, make you feel like you're not as alone. And so we have a great panel today. I'm going to turn it over to our nurse who's part of our clinical advisory board, Nancy Moldauer, and she's going to do the rest of the introductions and take it from here. So there you go, Nancy.
Thank you, Sally, very much. Welcome, everybody. This has really been a tremendous symposium for patients. I had the ability to listen in on some of the sessions today. And just to kind of echo Sally's words, you have all been enriched with so much valuable information. And now I have the honor, and I do believe it is an honor, to be able to moderate living with kidney cancer. As an oncology nurse, as best as I try to show empathy and feeling for my patients and try to walk in their shoes, at the end of the day, I am not in their shoes, number one. The second thing is, with all the nuances that we heard this morning about, just for an example, the financial toxicity about having cancer and getting these medications, I don't know half of the things that go on with my patients when they're home, when they're talking to their family members. Those are the things that I don't have the ability to have knowledge of. So with today's panel, it's going to be a series of questions and answers. We're going to start by introductions and having the panel share their story. But I encourage everybody to ask questions. I have a list of questions that I want to ask the panel. And for the next 45 minutes, hopefully you'll have some insight and be able to kind of know that it's okay to take the risk that our panel members have taken before you, and they can share with you what it's like living with kidney cancer. So with that, I'm going to start with introducing Marissa. Marissa is a 9-year survival of papillary kidney cancer. She's a member of the Kidney Cancer Patient and Caregiver Advisory Council. She told me that she works full-time. She has a very busy life that she enjoys to the fullest with family and friends. Our second member this afternoon is Stephen Edwards. And I learned from Stephen that he was a journalist during 9/11. And I hope that he can share some of that experience with you. And then after that, about 9 years later, he developed kidney cancer. He is now living with metastatic disease, has been on a variety of therapies, and is here today to share his experience with you and what it's like for him living with kidney cancer. So with that, let's start with our panel and let them give more detail into their journey, and then we can start with some questions. So Marissa, do you want to start today?
Sure, that's fine, Nancy, thanks. Hi, everyone. As Nancy said, I'm Marissa Willis, and I have had kidney cancer for 9 years now, and I'm surviving. I was diagnosed in 2013 and originally had a nephrectomy on my left kidney. That's where the disease was originally. And at that time, I would never have known I had it. I had no symptoms. I was healthy, exercising, eating right, doing all the things we're supposed to do. But it just came up that I had a weird feeling on my side. got that checked out by my primary, and my experience was within 2 weeks was having the nephrectomy. So my experience went pretty quickly with tests, and I was already a stage 2 when I was given my original diagnosis and had that surgery. I was disease free for about 10 months, and then my disease metastasized to a lung. With my experience, it was a kind of a watch and wait game, though, for about 3 years. After that, it was very small. Really couldn't quite confirm that it was metastatic disease, but my oncology team had a hunch that it was. So just watched and waited. And I'm kind of like Nancy said, I work full time, busy with my family, which is 2 sons that, involved in school and sports, and my husband's interests. And so just kept busy during that time. In 2017, 2018, went through a high dose IL-2, which is an immunotherapy that's been around for quite a number of years. Pretty strenuous, but can also be effective, and was effective for me. It has kept my disease stable. And then in March of 2020, of course, when the world was changing, started on Votrient. And I've been on that now for a little over 2 years. That has also kept me very stable and actually reduced my disease somewhat too, which has been wonderful. Throughout this whole time, just to really try and take advantage of life and what is out there and what I've been given.
Sure. Thank you very much. Stephen?
Yes, as Nancy said, I was at 9/11, and the reason why we mention that is because we think that's where consuming all that debris cloud and being there covering it right on site is where the kidney cancer came from. It's believed that like a heavy metal got into the body, carcinogenic, and so I was actually in Guantanamo covering the 9/11 accused 9/11 organizers 9 years later, when I was ill all night, and that was fortuitous because it had nothing to do with cancer. We think I'd just been to a pub. I had been to a pub and just got some bad food. But it turned out that when they gave me a CT scan, because a reading came up because of my vomiting, a certain reading, that's when the a 7-centimeter tumor was found in the kidney. So I came back to the States, nephrectomy, and then I was clear for at least 5 years. And I thought I got away with it. And I was quite happy having been at 9/11. Well, it's a terrible event, but I was happy to have sort of covered such a monumentous event. And then when I found out I had kidney cancer, I wasn't so happy anymore. So when metastatic was found, it eventually was found in the pancreas, dating back to 2015, and then started making its way, appearing in the lungs, neck, abdomen. And I immediately was offered a certain treatment at a hospital, what they call TKIs, Votrient, that Nancy says is working well for her. But I actually wanted to, more quickly, what else is out there? And I found out then about the IL-2 as well. But I didn't go on the IL-2 straight away because I was, I went on a trial. I was told about a trial, and it sounded very exciting. And this is one of the things we'll talk about later. Researchers will talk in an excited manner about their trials, and early on, while you're still a bit naive, you're going to be convinced that that's the thing. So anyway, fast forward to now. I have had many treatments. I still have my hopes in immunotherapy because the only real chance of a cure. A cure is very unlikely, they say, but some people do get cured, and it's not just from high dose IL-2 as well. Even surgery can cure. I'm talking about when you're metastatic. It can obviously cure when you just got the nephrectomy. You just got the tumor in the kidney. So I'm on a thing called ipilimumab, which is an IO, which is an immunotherapy. Another one called pembrolizumab, another immunotherapy. But I'm also on this cabozantinib, which is a TKI and shrinks the cancer, but it can't cure. But I've had other things like radiation to go after individual. It's very hard. It's sometimes hard to get to doctors to convince them to go after individual lesions when you're metastatic, but you can find them basically, and you can ask some people to speak up for you. And so here I am. I have cancer. I have some growing cancer, but I have a fairly low cancer burden, lower than I had 2 years ago.
Mm-hmm.
So, but I still have growing cancer, and we're just trying to take care of it as we find it. So that's my story.
Okay, thanks, Stephen. Thank you, both very powerful stories, somewhat different, but nonetheless, I hear echoes of being your own advocate and asking for certain things, or perhaps even talking to more than one doctor. So if this is a tough question, but do you think that either of you can answer this question? What is the most important thing you learned right away about living with kidney cancer? It's kind of a loaded question because there's probably not one answer, but just wanted to kind of pose that, and maybe we'll even come back to it after we're done and say, hey, that's my answer. What do you think? What is the most important thing you learned that you needed to know about living with kidney cancer right away?
You want to go, Melissa, or shall I go?
Go right ahead, Stephen.
Okay, so well, the first thing you do is you get on the internet and you start looking at statistics, right? You've got to be very careful with that. The statistics when you realize you've got metastatic cancer is really alarming.
Mm-hmm.
Just think you're a dead duck straight away. It's very, very, short, fairly, the median is only 2 years, and something like 92 or 3% on the internet don't make it past 5 years. So you have to realize you're an individual. Mm-hmm. You can actually be really active. You've got to have some luck. You can't have really fast growing cancer. There's probably nobody else to take care of that. So you've got to not say that the statistics are me straight away. I mean, let's face it, if you ever bought a lottery ticket, you do have hope in you wouldn't buy it in the first place if you didn't think you could be the one, right? So you could be the one in kidney cancer that gets out, or not the one, but the 8 or 10%. It's very rare to get kidney cancer in the first place. So why can't you be the rare one that gets out of it as well? You got to think like that.
Okay.
And of course, straight away, you just got to get into research, learning as much about it as possible, because opportunities do come your way and you want to know about every opportunity as quickly as possible. You don't want to learn 2 years later, if I'd done that at that time,
right.
If I'd researched more at that time, I would have known about such and such, IL-2 or something, and I would have had a chance of being cured or prolonging my life.
Sure.
So research.
So sounds like getting information, being a little bit, careful with what you, like you say, you read on the internet. And I can share with you how many patients that we see, new patients that we see in our clinic. And, they come in with all of their papers that they printed, and it says this, and this, and they leave with completely different feeling and story and plan for themselves. So when I see anxiety super high, and when they leave and it's tolerable, I feel that we've done a good job. And that's kind of a message that I want patients to understand. And I don't think the internet changes as fast as maybe when you're speaking to a specialist who can really tell you what's happening today. Marissa, what about you? What did you think is the most important thing you learned?
I would kind of echo on that. The internet is fine and good, but rely on your care team.
Sure.
They just kind of like you just said, Nancy, they are the ones that are keeping, very up to date, more than the internet, on the conditions. And each person's different. You know, it is kidney cancer, but each patient is different. And so just relying on them, you know, being your own advocate, but put some faith in them too. You know,
Yeah.
they deal with this every day, and, you know, they have a better idea than Google what your prognosis could look like.
Right. I mean, yeah.
Yeah. That's, and, you know, if, you know, depending on everyone's prognosis, you know, it's okay to, I've learned over the years to keep planning for the future.
Good.
You know,
Good.
I still do, and I'm going to. So.
Excellent. Excellent. Good. Okay, this is a question that I've come up with my experience with patients, and especially patients who are newly diagnosed with metastatic disease, about to embark on some, you know, new therapies. And it might involve a TKI, which is an oral targeted therapy. It might involve immunotherapy. Really big words, complicated treatments. At the same time, well-tolerated therapies, but they, you know, they change your life. So many patients have said, I really don't want to be the person in the room that has cancer. I want to be able to talk to people and you know, acknowledge it, but I don't want it to be the focus of everything. So how does one navigate that and make it so that, yeah, I'm almost like a person who started a new antihypertensive medication, or I've just been diagnosed with diabetes and I'm on this and I'm taking insulin now. What's the best way to help a patient kind of, I guess, maybe feel more normal and not be labeled by, you know, what their what just diagnosis they just received?
I feel like, at least with, you know, family, friends, colleagues, you know, it's a little bit what you want to talk about, but if you want to feel like that normal person, just talking about the day-to-day topics, family, friends, your kids, you know, vacations, those kind of things. I mean,
Keep it normal.
Right. We're more than our diagnosis.
Yeah.
You know, there's a lot more to us than just the diagnosis.
Absolutely. Steve, what's your experience with trying to navigate that and, you know, just kind of be the person you were before?
Yeah.
You know, you
well,
got the diagnosis.
I find actually it's the opposite almost. That at first, when you reveal you've got cancer, there's shock and a lot of sympathy. But then as you carry on going to work or whether hanging out or whatever environment you're in, people still see we look okay, right? It doesn't look like it's the slightest thing wrong with me, I don't think. And people with illness are used to hearing that like a work colleague or a friend is ill, and guess what? Then they get better because they get treatment. When this goes on for years like this, you almost get the impression actually people wonder whether you're faking it or something. I had a guy the other day dealing with something with my daughter, and he said, you know, mentioned some things about the time-consuming matter of the cancer, and he goes, "Oh, I thought that was all finished." That's all over, history.
Yeah.
Oh no, it's still very much a problem. And so I don't think it can actually be a bit of a problem when people actually think you're fixed, you know, after a couple of years, you know, you do still need quite a lot of time off work and everything. It's almost like, oh, you still got that, have you? What's going on? But I definitely, I'm never happier than when I'm talking to, if I want to talk about kidney cancer, it's with people that are talking about paths out of it, or, you know, oncologists, you know, doctors very much involved. I certainly wouldn't want to sit around everyone saying it's just so sad, and because what's the point? It doesn't get me anywhere, you know. I want to talk about people with knowledge that's going to make me think, put me onto something that's taking me forward. And if I'm talking about people, just ordinary people, I'd like a situation where, you know, we're celebrating the survival as opposed to I'm so sad, I'm sorry to hear your news.
Right. So obviously you and Marissa have demonstrated leaps and bounds in terms of coping with the disease. But if we could peel back some of this and you were to help somebody who is in your shoes, but is maybe just diagnosed, what type of things could you say to them that would help them, you know, in the coping mode of, yes, you've got this thing before you, and this is, you know, what I practice, and this is what I did. Are there any things on a day-to-day you would say to yourself, hey, I got to put that at the bottom of the list because I have, you know, 1 and 4 to do today. So how does that play out in terms of if we were to, if there's a question from the audience, how did you do it? Is that simplifying it?
Yeah, I'll answer that in as much as you can't get it out of your head. You wake up every morning and think, oh God, the way I used to wake up sometimes in the old days, if I, you know, just broken a big story or you know, everything was right, you got everything done in your life, you know, you wake up saying, oh, everything's really great. You know, you never wake up like that anymore, really. But you can't live in wallow forever and or be. So I actually do set times where you can take a holiday. Like tomorrow, I'm going to watch a bunch of football matches because it's the last day of football in England. And nothing's going to happen to me cancer-wise while I'm watching the football matches. So I can just switch off and not think about cancer. I'm not going to get ill during the football matches.
Okay.
So you take, and you can take longer periods. You're going on a holiday for 2 weeks to, you know, let's say, you know, to California, British Columbia. Switch off because nothing's going to happen to you in 2 weeks, right? This isn't a disease that's like strikes suddenly. And so that's how I would say cope a little bit. Just give yourself permission to, and then stop thinking about it. You can do that for a short period, but it's always going to be there. You're not going to just go back to your old life.
You're never. But I think, but you know, what you said is so important. Nothing's going to happen today or tomorrow, the next day. And so just live your, you know, plan things and enjoy.
Yeah. I fully agree. Just, you know, it is there. It's there every minute, and it can creep in worse some days if you let it.
Sure.
And sometimes we have those days, but you know, still planning those get-togethers. You know, plan a trip, go shopping, go your favorite restaurant. You know, just don't stop living because it's going to be there with you, just like a lot of other medical conditions that people go through. But you know, you realize that, you know, like Stephen said, you can turn it off for a while and go do those whatever things you enjoy. Right. Yeah.
And I know both of you know this, but the topic of CAT scans comes up, and that's always such a difficult time. Through the years, I'm not sure it's become any easier for either of you, but are there any things that you can share with our listeners about how to make that process a little bit easier as you kind of navigate this, because it's going to be there for a long time, getting those CAT scans?
Yeah. So with the CAT scans, it's torture. I always get my records more quickly than I wait for the doctor to tell me. So, when I first started reading CAT scans, it was a torture reading line by line.
Oh, yeah.
You know, so you got a good news. But until you've got through the end of the 15, 20 lines, you don't know whether the whole thing collectively is good news, that you're not just going to be deflated. So I do have a friend who actually reads the CAT scans first and then just gives me the Band-Aid, which is good, medium, not so good, right? So then when I go through it, I'm not all elated, and then there's some big growth on the last line, you know, so you're all deflated again.
Okay.
So that's how I deal with CAT scans. You really should. I don't always practice this. If it's Friday, I will actually put off reading results till Monday because I can't do anything over the weekend anyway. So I'm not going to have my weekend ruined. But on the whole, you should be getting results as quick as possible and acting as quick as possible. Because you know, by not getting them, you just put. There might be an important decision you have to make. You know, I mean, obviously, we just said earlier that things don't have to be done immediately. But what if your particular doctor specialist you've got to see, it's August and you delayed acting on a CAT scan, and then he went on holiday for a month or something like that. You see, you don't want,
sure.
you know, you
don't want
don't
that.
want situations like that. So
Right.
get your results as quick as possible. But if it's Friday night, you don't have to read until Monday, you know, like
I like that.
Monday morning.
Friday night's no good for getting result.
No.
Let it go till Monday.
It's going to stew all weekend.
Great advice. And Marissa, are you still getting CAT scans, and how often are they?
Oh yes, I get them about every 3 or 4 months.
Okay.
So it's just normal now. It's part of life to go and get these, and I also get my results in my patient portal before
Okay.
I usually go and visit the doctor the next day. And I just, when I see that email pop up, I go to a quiet place
Mhm.
and I take a look at it, because I
By
just,
yourself.
yes, I just need to look at it by myself first before
Sure.
sharing with my husband or family. And yeah, and it's for me, that's the way I deal with it. I like to look at it first, get that out of my system, and then I can, usually I read through it 4 or 5 more times.
Right.
Just to make sure what I read was
Yeah.
there. But yeah, I just a good quiet place, no distractions, and I read through it.
But Nancy, let me just add this as well. You really should be reading your scans before you go to see the doctor, just like Marissa said she does as well. Why? Because that spurs a lot of questions. You don't want to get the information from the doctor, and often it might only be the impression, meaning the summary at the top, and then come up with questions later on in the week that it's hard to get an appointment again. So you should be actually reading everything and writing down your questions and going with all those questions based on what you've seen in the CAT scan.
On the report, the written report.
Yeah,
sure.
the report,
And that helps to prepare and kind of develop a framework for the visit, so that you get all your questions answered. Absolutely. Because being prepared for a visit is another way of kind of coping and having some control with living with cancer and what goes on when you have your meeting with the doctor. What, as far as, you mentioned several times how important it is, the relationship with your physician. And maybe you can elaborate a little bit about how does that help with living with kidney cancer? I've heard, having a good meeting with CAT scan results, but is there anything else that you can think, and the good news is that you've had such a long year, so many years of this. Sometimes we just forget what happened many, many years ago, which is a good thing. But is there anything that you think the healthcare team can do that can enhance a patient's experience, so that living with kidney cancer can be purposeful and have the ability to maintain your normal life? And let me just add, maybe an easier way to answer this question is, have you noted any gaps in healthcare that contributes to a more difficult time living with kidney cancer? And then after we answer these questions, we're going to see if the audience has any questions they'd like to ask.
Well, Nancy, what it is with kidney cancer is there's absolutely no consensus on how to fix it and what approach to take, right?
Okay.
I've been to a couple of ASCO meetings. That's where the oncologists go, and I've been as an advocate. And sometimes they'll, with the audience, and everybody in the audience is an oncologist. So they'll put out, we have patient X and we offered him A, B, C, or D.
I see.
And so there's 200 or 300 people in the audience, oncologists, or a couple of hundred, and you'll never even get a majority agreeing, meaning over 50%. You'll get a plurality of about 35, 40% agreeing on any one treatment. So that is the reason why you have to go and see different doctors to end up with your approach. My approach is to go to immunotherapy and take the gamble on trying to get a cure, right?
Okay.
Other people's, sometimes your doctors, my first doctors at a certain hospital just offered me TKIs. You're not going to be cured on a TKI. But they have very good initial results, so they look great. And then after 10 months, when they start working, it's not so good then. So you've got to do that. So what can the caregivers do? You said perhaps be what can they do? Well, you've got to, people come in and do their job. You've got to sort of present yourself as somebody who doesn't just want to be processed by this person and now go to this room and this room. You want to be treated. And so you've got to express your desires, and you've got to put over your absolute desire, not just feel, well, I want to live, doc. It's absolute desire to show that you want to live by absolutely researching, going well prepared, really showing that you're doing everything you can. And it's just like being a teacher. If a student's coming to you all the time showing they're doing extra homework, naturally teachers are supposed to treat everybody equally, but naturally that teacher will be gravitate towards helping this
pupil. Right.
And I believe it's just the same with doctors as well.
Interesting.
More intention. You want your name in their mind when they're at some conference and seeing something. Oh yeah, that might be good for Edwards or something, you know. So,
yeah, good point.
So
I like that.
Yeah, that's what you got to push for. Get your desires over. So they're seeing you as a person. I'm not saying doctors don't see you as a people. But,
I know,
but it still is just a job in the end. I mean, I was a journalist for many years. Each story is just a story in the end, right? You've got to go on to the next one. You're not personally involved with each one. It's the same with doctors. You've got to try to get them personally involved, though.
You got to tell your story of what's
tell your
important
story.
to you.
Yeah,
tell your story
and your desire.
And I see Marissa shaking her head.
Yeah. I mean, some of the gaps can come from just going with what the doctor tells you. You've got to advocate. You've got to ask questions, and keep them in that room until you're done asking the questions.
Yeah.
You know, and hopefully, if it's a health system, the one I am with has a patient portal, and they're very responsive. So, you know, don't be afraid. I mean, I will send something at 7 a.m. You know, if I think of something that I had a question on, or, you know, I'm not afraid to ask the questions. You know, it's my condition. I want to know, or, you know, figure out what I need to do.
Sure, exactly. Okay. Let's see if there's any questions from the audience. Let's see, what have we got? So I don't see anything in the chat, but I would like to open it up to the audience right now. And if there's any questions, I know that Stephen and Marissa are anxious to hear from you. Anything, Sally?
Nope, nothing yet from the audience. So, you know, it's up to you guys if you still have some things to cover, or we can wrap up early and get people back to their Saturdays.
I got a little thing to add. Is to live with kidney cancer, you've got to always remember, we were talking about it's statistically very bad, you know, bad news to have this thing. But you can keep hope alive with research, with advocacy, with consulting different doctors' approaches. And you've always really, I got a bit depressed recently again, because a couple of treatments that seemed to work at first stopped working, had some new growths. But now I've just got back onto a new pathway of a hopeful way out of this. And if everything goes right, you know, so you've always got to have a path of hope, you know, a roadmap of hope that could get you out of it. Now that roadmap is going to change all the time as the years go on. And but if you can always see in the next few months, well, my treatment's going to roughly go in this direction, and we'll take care of this with this. You can be a bit more buoyed, or buoyed, as the Americans say, than you can if it just looks all dull and there's nothing left, you know. And I'm a little bit buoyed again now after last week. But some weeks before that, I was actually quite down because, you know, scans from November started not looking so great again, you know. So you can, so the research pays off, because it's not just practically or physically that hopefully could get you out of it, even emotionally as well. You can
Mentally.
live day to day.
Yeah.
Mentally, you can live
Yeah.
day to day. So
Great point. Great point.
Great. We do have a couple of things that have come through. Somebody has asked if you guys can offer any suggestions on what their family or friends could do to better support them while living with kidney cancer.
For me personally, when family and friends will just, take the time to listen, and it's scary for them to talk about, just kind of like it is you as the patient. But as patients, we need that. If we need someone to listen, just that if they'll, be brave with us and listen. But then also, like I know, like for myself and maybe Stephen too, we've lived a long time with this. So at the same hand, we are still those people that we were before.
Mhm.
So if they can just support us in that way, if they're living long term with the disease, don't forget that we're more than the disease, and we still want to do things and go places and watch movies and do all those normal things, that we did before too.
yeah. I think it's hard on the family and friends, but especially the family, especially the children, right? You can definitely notice, like we live in Manhattan, the apartment's small, and so they can hear conversations on the phone and all that. Everybody can, and so it's hard on the children. So what can they do? It is a matter of support. Try to, one of the worst things about this cancer and doing everything I'm saying we should be doing, the research and all this, it's extremely time consuming. Like 50% of my time is exclusively on, cancer related stuff, visiting doctors, treatments, waiting, because just making a phone call to a hospital is already like a 45, 50-minute job. And then you wait all day for the answer. So it's extremely time consuming. And so you have to live your what everybody else, you have to live a whole life. Everybody else has 100% of their time. We just have 50%. That whole life has to now go into 50% because 50% is taken on with cancer. That's where family and friends can come in, as perhaps alleviating all the time that's taken up and helping you out with things that that can actually save your time. But if you're doing it as much as possible, you'll find that it really cuts down on your time to do other things, live a normal life. And so family and friends can help you do that.
Great. There is somebody else who sort of shared similar feelings with you, Stephen, that, their scans are usually performed within a week of visiting the doctor, but they sort of wait till the day of to read theirs because they don't want to be all consumed with might be something incidental or small, but that they're still prepared for those questions. So I think it's finding that good balance in terms of being prepared. And you guys, I know Kathleen wasn't able to join us today, but one of the things, she talked about a lot was, as a caregiver, that communication being important. And don't be afraid if you're not sure, either as the caregiver what support to offer, or as the patient what support you feel you can ask for it. Tell what you need, talk about it, ask the question, is there anything I can do? It doesn't hurt. Don't expect on either side that you're going to be able to read each other's minds, and just really take each day as it comes, because those needs are going to change from a day to day and over the course of care. Any other sort of last minute things that, you could recommend in terms of, like if you're seeing, and one of the questions that came in, I think if I understand it correctly, is if your doctor is recommending something and you sort of think you want something else, how do you get across what you want, especially when you don't feel maybe, hey, I'm not the doctor, I don't have that type of expertise, but I'm not really sure I want to do what they're suggesting. How do you recommend starting a conversation like that?
Well, I just think, you're not the doctor, but you can say, well, I was reading about such and such, and it suggested this, and it went in that direction. What can you tell me about this? And can we discuss this a little bit? As opposed to saying, I want, cabozantinib.
Well, and Sally, isn't that a component? I mean, isn't that shared decision making where options are presented based on evidence. Sometimes a patient may ask about something else. And I think if a conversation is had between the physician and the patient as to perhaps the patient doesn't want to go the traditional way. And they talk about it and communicate and decide, okay, this is not the patient's goals. These are not his values and beliefs. I presented that I think, has value, but it doesn't translate to value for the patient. And so
Nancy, you did my job better than I could by totally making us coming back to our first, sort of talk and panel discussion today, which was shared decision making.
Yes.
And that is something, if there are any healthcare providers on the line, to remember too, is yes, anybody with kidney cancer or cancer at all, they want to be cured. They want to be treated. But at the same time, there's other things about their life that maybe you should be asking about to figure out what treatment is important, what side effects are going to be more bothersome for one person over another. And that discussion is what's really important. So I want to thank you guys today for being part of this discussion, offering those viewpoints. I think letting people know that even if it's one tidbit of like, oh, somebody else went through that, no matter how many times we say that, a lot of people think they might be the only ones having that thought or that feeling. And it's not the case. Not to say that your feelings aren't important, but there's somebody out there that's felt the same thing, and talking to others can sometimes make you feel less alone. So thank you guys today for that.